We're going to be joined via video link by health activist Dr Kgosi Letlape to weigh in further. A very good afternoon to Dr. Letlape. Thanks for your time with the SABC at this hour.
Good afternoon to you and to the viewers.
Let's look at the issue at hand, and perhaps you could unpack them a little bit further. Just in the wake of South Africa needing doctors but not being able to afford them, walk us through what's happening.
Well, clearly, our problem is the inability to absorb healthcare professionals, which is basically budgetary constraints, which basically arises from a structural design, and we spend money in inappropriate areas, and we don't have money for the key areas. Given the budgets that we have, we should be doing better, but we need to move money from wastefulness, from administration, from corruption, to employing frontline workers. And we need to ensure that the public healthcare system begins to work differently, where the institutions need to have line budgets for different items, and they should be having line budgets for human resources that they need in accordance with their capacity and the number of patients that they see.
And so thank you for setting that context. In the wake of this, I mean, what has been government's response? Has it been sufficient? I'm just looking at that because some of the developments from the university side is that they've increased the number of medical interns by about 60%. But the concern is that Treasury hasn't responded or increased the provincial healthcare department's budgets at the same pace. We're also looking at worries about a brain drain as a result. Talk to us about that as well.
I think the key aspect has to be health becoming a national competence, so that everything comes from central planning. Whatever we have in our human resource plan, when it goes to provinces, it's a question of implementation. And we must ensure that from the center, our human resources health plan is properly funded. So it's not up to provinces begging Treasury for special monies. If you just go recently, when we had COVID, we brought in a lot of healthcare workers and healthcare professionals into the system. Post-COVID, there was no money to keep. Poor planning, lack of national competence, things being left to provinces, and when the monies get there, they get used for other things. Either we create proper conditional grants to manage human resources on a national basis so that we can ensure that we have money that is properly set aside for human resources. When it comes to the issue of brain drain, I think we should commend our young doctors for being able to organize a march to go there, because they are trained in South Africa, they are South Africans, and they want to serve South Africans. And I admire them for not wanting to walk out. And it is our duty to ensure that we have a system that is receptive, that will create employment for young healthcare professionals. The problem is not just about doctors. It's also about nurses and other members of the profession that are not absorbed into our healthcare system. We're spending money in the wrong areas. We need a structural redesign so that if you are dealing with an area that is essential, where the right is written into the Constitution, it should not be up to Treasury whether they give you the money or not. It should be built into our basic systems, and what we budget for, some of that money should be devoted for human resources.
So Dr. Kgosi, on the back of that, there were sentiments about the health care system being in a crisis just because there are no posts available. This obviously has knock-on effects in terms of quality of services that are rendered, particularly in the rural areas, issues of training for doctors as well, and then obviously the lack of matching between Treasury and training. What are your thoughts about that? Are we heading into a crisis? Are we in a healthcare crisis?
I think anybody that doesn't accept that health is in crisis either doesn't live in this country or doesn't use the public healthcare system for their own healthcare. We are in crisis, different levels of crisis in public, different forms of crisis in private, but all our health system is ailing and it needs urgent intervention, where we need system reforms, where we curb what we spend on administration, where we spend most of our money on patient care, which would mean proper infrastructure, well-funded human resource health plans, money for consumables, for capex, for equipment, so that even when we employ these healthcare professionals, they come into an environment where they are able to practice their profession.
Well, and this...
Yes, we are in crisis. We need new direction. We need new leadership. We need decisiveness. We need a parliament that cares about all citizens.
And Dr. Kgosi, this is why, with the calls from your end on system reforms within healthcare, you're looking at NHI. We're looking if this is the way to go, how this is also going to impact the healthcare system at large. Is it the right way to go? Just very quickly, I need to wrap up. Is this the correct approach?
It is not the right way to go. Right now, the minister is not able to say to you, give me NHI and I'll be able to employ all the doctors.
Yes.
Because that's not how that fund is structured. That fund is structured to buy services. But how do you buy services from institutions that don't have the personnel to provide the services? The people won't go there, so NHI money won't make it into those hospitals. You know, what we're talking about NHI, it's like you have a car problem, and the mechanic tells you you got engine problems, and you go and buy a new set of tires.
Well, Dr. Kgosi...
It's not necessarily money, it's not spending it appropriately.